We're right on track to get started with our final session. I think our guest speakers would say we have saved the best for last. Our topic is around simplifying cost reports and demonstrating the impact those have on county board operations. And we are very excited about this next, definitely our last conversation, but an absolutely critical conversation in this business manager's track. So thank you all for coming back for this last session. We appreciate that. One last reminder, there's I want to pronounce it properly, an annual awards banquet tonight from 5 until 6:30. A great question came up earlier. Folks were searching in the program for when things start tomorrow morning. It's kind of embedded in there, but we'll make it real easy. Things start at 9 o'clock tomorrow morning. So same start time as the past 2 days, but 9 o'clock tomorrow morning. Want to thank our sponsors, Britco and Haynes, Kessler, Myers, and Postalakis for tonight's annual awards get together. And we want to thank Primary Solutions, who has sponsored the business managers track this year. Really appreciate their support. And introduce to you again, Liz Thompson, Director of Operations with Primary Solutions, before we get into the next program. Liz?
Hi, everybody. Again, we just want to say thank you for the opportunity here with OACB to sponsor the Business Managers Track. I'm Liz Thompson, the Director of Operations at Primary Solutions. I think I'm actually just going to hang out here because it's really warm in this room compared to the hall. So, so don't mind me. No, in all seriousness, it really is our honor. We are excited for 2025 and what it's going to bring, especially to really roll out our Finex solution. And so hopefully we'll see you along that journey, or if you have questions for us, we are at the booth and we can answer those questions. And on behalf of Primary Solutions, say happy holidays. Hope everybody has a safe and joyous holiday season and starting off the new year great. So thank you.
Thank you, Liz. And again, thanks for your support and wish you happy holidays as well. So our final session today is on simplifying cost reports. And I think we can all agree that having accurate financial data, be it necessary on the local level or kind of collectively when trying to put together good arguments and good presentations at the state level, having good, accurate data that represents all of us collectively as 88 county boards is absolutely critical. And you as business managers know better than I do from your previous conferences and things. There's always been a lot of conversation and thankfully good collaborative discussion between the department and county boards on how to simplify things and how can we make it more useful and simple in some cases, but meaningful, being the outcome that we're really all after. We know that can't be resolved overnight, but thankfully we've got great people that work on it regularly and are constantly trying to improve things. And some of those folks that are involved in that almost on a daily basis include Sam Jeyandran, Medicaid Health Systems Administrator with DODD, Cora Stewart, Medicaid Health Systems Specialist with DODD, and representing and then chair of the BLT committee in the state, Julie Estes, business manager with Clinton DD. They've agreed to be on a panel to kind of discuss this cost report topic and field any questions that you might have. So without any further introduction, please help me welcome Sam, Cora, and Julie.
Which one? Okay, so. You're gonna get us started.
Oh.
Sam's gonna get us started.
Okay, most of you know me. My name is Sam Jeyandran. I've been doing this for the last, I even forgot, last 30 years. Comes naturally to me. I'm a past managerial accountant. So a lot of the times people have a lot of struggles. It's not with the cost report, it's mainly setting up, gathering information. You know, it's a year-long process. That's what Clay was trying to tell. You know, you guys like don't just do that for a week or so and don't wait till the end of the year to do your cost reports. So the agenda, like, you know, we're going to talk about a little bit about the CBCR redesign discussions, and then you know, TCM's yes, right, best practices. Julie going to take us through. One good news though, I just got a good news for you guys from ODM. They approved the settlements today. So that means we will be getting the ISTV to them tomorrow, and then we'll be doing your settlements hopefully by next week. So we have kind of for 2 weeks before the holidays to get it done. So the total settlements is $47 million, which is TCM takes a lot piece of it. 42 or something is TCM. So I'm going to talk a little bit of TCM too. And okay.
Okay, as many of you in the room know, we have been having a lot of discussion on the county board cost report redesign. Back in the fall of 2023, DODD put together a committee for cost report redesign. This is a separate committee than the typical cost report committee. There are, I believe, 6 business managers. We have a COG representative, an SSA director, and an OACB representative, along with DODD staff. Our task on the cost report redesign committee is to look at the changes. As we all know, we've faced a lot of changes in the last 10 years, the way we do business, as far as what services we provide. So we are tasked with reviewing the county board cost report and determining what type of things that we would like to see updated to make the tool work better for our county boards. As of right now, the main purpose is to settle the TCM rate. So, however, right now, the cost report is still seeking all that old data for all the adult services that we no longer provide. So we are going to be looking at these things, taking recommendations, and then providing our recommendations to DODD, who will then take it to CMS. So in doing this, gathering ideas, we started this process at the business manager conference in September. So Rachel Malone and I led a discussion at the conference just to ask for input on what you would like to see change so that we could take it back to the cost report redesign committee to consider. So anybody who has come up with some additional ideas since that point, please let me know and I can still pass that along to the committee. But some of the things that we need to consider when we're looking at what changes to make is how it's going to affect the comprehensive cost report. Many outside entities look at that comprehensive cost report to gather data. So you have legislatures, lobbyists, other, it could be your county officials could be looking at it. So we need to be very careful in what we remove or what changes we make so that we're not causing ourselves issues because we are not sure what people are using and pulling from it. So we just need to really keep that in mind. So ultimately, the biggest thing I want to stress is while there's the cost report redesign committee who is going to be making recommendations, ultimately, any changes that are made have to be approved through OBM and CMS.
It's ODM.
I'm sorry,
Yeah,
ODM.
Sorry, we have this slide. It's Ohio Department of Medicaid has to approve it.
That's okay. So anyway, ultimately, it has to go before them for approval. So just because we make the recommendations does not mean it will happen.
I'm going to stand up. I can. All right. So time and time along, I'm going to show you guys a spreadsheet too. I struggle with TCM. When TCM cost comes in, your SSA cost comes in, you know how your TCM is allocated. Your TCM is allocated based on your total SSA cost. And, it's not, there's no TCM cost you report on the cost report. It's your SSA cost come in there. So basically your TCM rate, it says TCM cost divided by TCM unit should be same as your SSA total cost divided by total SSA units. So when we get that cost, we look at 3-4 different things. There it says how it's calculated. What I look at is every time I started talking about TCM, look at the TCM to see what are you reporting on cost report. Then I run the MBS report. That's ours, what you build. So I'm going to show you 2023 that 6 or 7 counties that your 23 billing is not even done. Okay, you have 1 year to bill. End of December, your billing will be done. And then if you have any more issues, then each time you send something to Medicaid, I think you have 6 weeks, 3 months, whatever it is. 6 or 7 counties already have more cost report unit, more billed units than cost report units. I don't know how you guys come up with it. So that's what I'm going to tell. Where you get from your Britco, whatever it is, don't just trust and take the numbers. Your job is not taking the numbers and plugging the numbers into the cost report. Your job is to verify the numbers, and you do some internal control all the way along the cost reports, because one of the questions that Medicaid, this is the second year they have asked, why is your TCM settlements going up? Okay, so we kind of tell because the other 2 services are going down, therefore you're hiring, I kind of bluff my way through saying you're hiring more SSAs, there's more SSA units there, and and they're not that knowledgeable to go in and look at it, but they just put those things in there as reviewed. So if CMS comes to them and we have a conversation with CMS, then our justification has to be a true justification, saying, hey, how many people you're serving, how is this cost, and also your efficiency. They will look at the efficiency ratios too in there. So, so one of the, that's on the TCM. I'll show you a spreadsheet 2023 as soon as we go through that. And also your allocation of cost. Your allocation of cost is a lot of the times we find people moving numbers between program supervision and indirect cost. So people just putting numbers to see what you're getting. If you are playing that, I don't want to say it, but if you're playing that guessing game, that it could be devastating to the whole program, because your statewide average, one of the slides I'm going to show you, your highest rate and the lowest rate in some of the, I mean, I'm not that much worried about the enclave and facility-based services because those 2 are going away. But TCM is kind of alarming, which I can show it to you guys. And the AOS started, I think this is not related. AOS started reviewing your job descriptions on these MAC, right? MAC stuff, and they're having findings on that. I don't know. That maybe we can talk to our audit section, because your audits are not pure financial audits. They are agreed upon procedure audits. So we give them what to look for. So I'm going to meet, I already talked to Clay, I'm going to meet with the audit section and say, were you looking at job descriptions? But also, I mean, as we know, a lot of the times, our job descriptions and what we do not match. Do not match. Because so that's one of the things to keep in mind.
Just real quick on that, job description, what I have seen with the AOS is
uh,
Go back to the original. Yeah. There we go.
what I've been seeing with the AOS is they're saying that the job description that is listed on your actual document does not match where you're categorizing these individuals at. So I've been seeing them move them to other departments, and a lot of counties are going back and forth with them because they don't agree because of what the person is actually doing. So I would just recommend that whatever the individual is doing, make sure it's documented on that piece of paper, because that's what AOS is looking at. They're not going by what you're telling them. They're just going by what's on that actual Word document.
okay. So what's about the donations? Was there some, you guys did the audits.
That was also from the AOS. A lot of times, some counties are saying we've helped a company, we gave money to help a company start up. So any startup funds is considered donations. That is what AOS is going to call it, even though you're not wording it as donations, and you're just saying, hey, we're helping this company start up and get going. AOS is going to consider that as donations, and they're going to say it's in NFR.
Okay, go to the other slide. Okay, this slide is, you guys should, when you look at it, that should truly alarm you guys. So if you look at the, this year's 2023, if you look at the highest rate for your TCM is $90. If you look at the lowest, it's $23.38. So the $32 in there is your average when you don't exclude the outliers. When we do your settlements, we do a 3 standard deviation, and we do the outliers. We kick people who are high and low. So the 90 will be kicked. That's what your settlement rate in there is 36.42. Is that 36.42? Yeah. That's your settlement, but your actual average is 32. Your lowest is 23.90. The year before 22, that 55.71 was 90 some dollars. We worked with that county, and we made sure they adjusted their units. That dropped almost 40 some dollars. So all we're asking is, wherever you get your stats, Britco, or is it Britco now? No, Gatekeeper, right? Yeah, so it's, you know, it's, when I first joined, somebody told me garbage in, garbage out. So you guys are giving me, we are reporting the numbers. And now that ODM started asking questions, so I have my staff go and slice and dice. Ask him how many times we meet, and I tell him, hey, have you contacted the counties? We need to work with them. We need to bring these rates down. Otherwise, it's, you know, it's high. 90, you can't have 90. I know that you guys don't pay your SSAs that much money. If you do, I'm going to college. I'm going to college, and I'm coming back to work as an SSA, you know? So these are little things that, you know, we tell you, but we kind of look through it, because we don't want ODM to be alarmed when we do the settlements, because the TCM's been going from, when I first started doing, I think Christy used to work for me. So she did, 32 million? 32 million. Now it has gone to 42 something. And also your facility-based and your enclave, one of those was because you were paid, your AAI ratios were paid higher at, you know, 20 was A1 and B was paid at C. 21 was the A and the A1s were paid at B. So that settlement was little higher, but I did not tell that to ODM. I said, well, it's going down, so it's economies of scale. So I truly can keep them out of this thing. So I said, it's the economies of scale kicking. And it's true that because your cost is there, but your units are going down. You're not providing the services, thereby it's increasing. Another thing about this $90 get kicked out. But if there's other dollars in there, if it doesn't get into your 3 standard deviation, your settlement ceiling 3642, you are pushing someone else's rate up, high up. And I'm going to show you a spreadsheet what happens if you're not below the ceiling, that when your settlements comes, you're putting your match money to make it 100. Also, the gap that you have, you had to put additional match money because feds are not reimbursing it because you're above the ceiling. So I'm gonna show you a few sheets without no names, okay? No county is in order, so you can't even guess. I just, me and Clay talked about it. We don't want to be, even when we do the DCs, we have only 8 now. We do not show the names. We just told them, hey, here's your rate, here's your something. Eventually they will know because they bill. So that spreadsheet. Yeah. Yeah, I have about 100 worksheets open up. It's already open. Yeah. Is it showing? Don't go left. Okay, because that's where their names are, county names. I don't want to show them. Okay. Do you guys see that? So this is your 2023 cost report information. So these counties I put investigate is what I send it to my staff, say that your units, if you look at your MBS report, you build more than your TCM units on your cost report. That can't happen. There's no way that should happen. And one county is telling me that their total SSA allowable units is 10,000, but hey, what? I built 10,774. So you're not checking the units that you're reporting, or you're just getting it from your system and plugging in numbers. So if you go further, go to the right side. Okay, so if you look at it, so I did what's the your settlement ceiling and what's your rate. So column N is the additional funds that you have to use because you are above the ceiling. The column L is your federal reimbursement, which your rates times your, I just used average FFPs, okay? And then your match is you have to put your match to pay, but your additional match is because you're not getting the federal dollars in that. So that includes your federal money plus your match. So that's what, so if, Cora, go and take the filter off from the unit test. Cora, make that bigger. Make it bigger. Okay. Yeah. So go to the right. So if you see, if you just scroll down, please. If you see, there's one person doing 700 some thousand. Altogether, there's 742. That money can be used for something else. That's what I'm telling. There's 4.5 million worth of additional money. Now one county, whoever the counties are in there, are putting their local match to subsidize for the TCM rate that are above the ceiling. So you don't know, you guys are paying it, but you guys are not looking at it that way. So I looked at it that way. We looked at it last year too. So, so the units, we will contact the counties that I have in the formula. Just say, you know, when I put investigate, it's just contact the counties just to see with you guys, hey, what's going on? Can we change? Can you look at your units? Can you look at your total SSA units, allowable units? So that's one of the main things that I have doing. What's the other ones in there? Yeah, hit the PowerPoint. Oh, switching. Okay, go to the other slide. What do we have? Okay, you're doing the best practices, right? Yeah. Okay.
Okay, so with simplifying the cost report, you can help yourself throughout the year. The cost report is a year-long process. Every time we pay a bill, we receive a revenue, we are cost reporting because whether it's us or our fiscal staff, we're assigning the state account code so that we know where to put it on the report. So as you're going through, here's just some suggestions of what you can do throughout the year to make it easier on yourself when it comes time for cost reporting. And I'm sure many of you in the room already do this and probably even have some additional suggestions to add. But the monthly, quarterly reviews. So when you're throughout the year, check your quarterly reports, like either monthly, pull your SAC reports, whether you use InFAL, you use your county system, however you do your state account reports, look at them monthly, quarterly, look for variances. If you see an inconsistency, look at what's going on to see if you can find what, it could just be an error so that you can make an adjustment at that time rather than waiting until the end. So constantly check and monitor your cost statistics. By doing this, you can check your productivity. If you're not already checking your SSA productivity, you should probably be doing that. Pull your reports, look at your units. If you see something different, compare it to your prior year. If your units are varying, find out what's going on and ask questions. If your units are significantly lower, it could be you have an SSA maybe out on extended leave that's not contributing to additional units. Or it could be that maybe just something isn't being coded correctly. Look into it rather than waiting until the end of the year, because if you wait until your cost reporting, it's too late to be able to make any kind of adjustments, perhaps. Definitely, and while you're looking at your units, also look at that trend analysis, which pretty much I already explained. But communicate and follow up with your department. So if you have a change in operations, ask questions, look at how it's going to impact your cost report. For example, if you start a new program that you haven't done before, maybe you hire on a provider support coordinator and are offering provider services that you haven't in the past. Ask questions. Where do you report that? Where do you code it? Look at that then, and that can help you save a lot of time when you go to cost report. And if you aren't able to figure it out, you have lots of resources you can check with. You can check with your fellow business managers. You can check in your region. You can, if it's not in the FAQs, if you look at the instructions and can't find the answer, you can always email DODD, which their email address for questions is on the slide. So ask them at the time instead of waiting and then having to change everything if you didn't guess right. Just ask to be sure you know what you're doing on it. If you have, the next thing, reviewing your past audits. Several of us in the room probably have not been audited in quite some time. Bigger counties, you've probably been audited on an annual basis. And I know I'm throwing myself under the bus when I say this, but I haven't had a cost report audit for quite some time. I believe 2014 was my last time. So that neither means I'm just that good, which is not the truth. But so I just don't score highly on those risks. But if you have gone through audit, look at your audit adjustments. What are they looking at? And make sure that if you have had an adjustment, that you go back and fix your later cost reports. If you haven't had an audit, really pay attention to the audit trends during that annual cost report training to make sure that you're listening to what other counties are experiencing and then apply it to your county. So, and if you do find something you need to adjust through the year, whether it's from looking at prior audits, or if it's just a regional discussion where people are like, oh, we should be coding this here, and it's kind of news to you, ask DODD to open your cost report so you can make the corrections. One example I had an SSA who was out on extended leave for a good 6 months. So she came back and it crossed years. So when she came back, she had units that there were TCM units from where she did not stay up on her TCM case noting, which is another issue, but she didn't stay on top of it. So she ended up having to go back and still bill her units, which changed my units for my cost report. So I had to go and ask DODD to open it back up, make those adjustments, correct my units. Of course, I had to get my superintendent to approve it again. So any superintendents in the room, be understanding if your business manager is coming to you and letting you know that you have to have it reopened, that's a good thing because you're avoiding issues if you do get audited and getting the best data possible. So, and the one thing on that I really want to stress is that if you do need to make adjustments to your cost report, you need to request that DODD opens it up and you make those adjustments prior to any audit starting. Once an audit has started, it is too late. So definitely go back and look at your work, double check yourself. None of us are perfect. We all make mistakes. It will happen. So, and it's okay. The good news is there's a way to correct it. So you can have good data out there. And does anybody in the crowd, does anybody else have any other kind of best practices that they do that would be helpful? Crickets.
Later. It's late in the afternoon. So anyway, so the settlement's going to be December. We're going to put it through. So you guys will get all of them. Most of you are EFTs. So you should get, the good news is none of the counties paying, only the COGS. So we have to bill them. And after the 2024, we are going to do the settlements each year because the 22 audits being done. There is 3 or 4 more counties to be audited. 2 are in progress. Once that's done, we are hoping early next year it'll be done. Then we'll be settling them in our fiscal year 26. That's what we have budgeted. That'll be second half of the calendar year 25. So we will get the settlements in. Also, I had a lot of questions. People keep forgetting. We say settlement's going to be this year, a lot of questions, but please, when you guys send it to show the report coordinator email. Do not send it to an individual. No Sam, no Clay, no Christy, nobody. Please send it to the coordinator because Christy is out. That email is going to stay there for, say she's gone 1 week, that's going to stay there. If it is there, Cora, Scott, me, Christy, Clay, somebody will answer. And my thing, I mean, sometimes they get annoyed with me. The question comes in, I'll tell them, hey, if you know the answer, don't sit on it. Because you're asking, maybe you're waiting to tell your superintendent or somebody, you know, you asked a question. So please send it to the report coordinator. So we do have, that's the same for CBCP and CBCR, right? Yes. So,
This was the other one.
yeah, So after that, it's this is probably the most interesting stuff that you guys going to hear. All you heard was the boring stuff from Sam. I tell you that every single year, you know? Okay.
So we took the comprehensive report and we put it into Tableau. We haven't released it yet. Tableau, we're just gonna soft launch it to you now and give as much feedback as you can, because we want, this is for you. This is for everyone to use to be able to tell a story of your county board is strictly the numbers that you report to CBCR and comes from the comprehensive report. I'll do it after I log in.
Oh, sorry.
Okay, so this is the dashboard. This is when you when you get access and we actually publish it. This is how it'll look when you go in. Across the top is all the revenues, the federal, state, local, capital, and then, hello? Okay. Under that is the expenditures, the adult, other category expenditures and support services. This map is the individuals served. Now, it does not include your waiver. It's only the individuals you report in your CBCR and your cost reports. So you can click on any county. I'll just click on. Trying to find Clinton, so small. I'll click on Clinton since Julie's up here, and it just shows you can you can hover over it and you can see how many adults are served, how many the cost, the adult average, the 0 to 2 year olds, the 0 to 2 year old costs, the average, and then the 6 to 21 year olds and their costs and also their average. And it's also over here where it's the total number of individuals served within that county. And then out here is the 0 to 2 year olds. And then here is the adult. And then here is the 3 to 5 year olds. So to get out of this and to go back to see everyone, you just click in the white area and then you'll be able to see the numbers update within the pie graph. Remember that the map and the pie graph are connected. So I'll start drilling down into the revenues. You can just click on the little drill and it'll eventually catch up and go into there. Here you can see the federal, state, and local, and this has all the counties in there. So if you want to just see your county, you just go up to this talk section and click the down arrow, take off all, and then just click on whatever your county is. Or you could, if you want to look at multiple, you can click how many you want, hit apply. And then there's your numbers. The federal, state, and local. And remember, these numbers are from the comprehensive report. Go back home. This is done for state as well. Same way. You see that it's still filtered on Clinton. You can just clear it out. Hit apply, and it'll show everyone's. Same with the expenditures. So you can drill down on expenditures, no matter which one you click, and you can see the different categories. The adults is the facility, enclave, and community. If you want to drill down on these as well, you can do that. Click on whichever county you want. Hit apply. And then it'll show you where the dollars are at. Go back home. You can always click home to go back to the home page. And then I'm going to go over to the menu. So in the menu, here's where there's trends. You can click on any one. I'm going to start with the revenue trends. So with the revenue trends, you can also, this is everyone. This is all 88 counties. At the bottom, that's the state. The middle green is local. Then at the top is federal. You can see it with the little dialog box that pops up no matter which one you go to. And then you can also drill down to see your specific county. And you'll see your numbers. You can go over if you want, if you don't want to just see 3 million, you want to see the actual number, it's at the bottom. And it's also, if you hover over that category, it'll also show you the local for 2021 was 1.9 million. So hopefully this can help you learn to tell the story or see the story if you really didn't understand the comprehensive report, because I know it's just numbers. So now you have a little bit of visual. Same with the expenditures. It has the different categories across the top and the colors, and then same. It seems like a lot because it seems busy, but that's the different type of categories that you have, and just drill down to your county. To see the different program costs. And you'll see them at the bottom as well, the numbers spelled all the way out or appear if you hover over instead of just looking at the small, the rounded up number. We have the rates in here as well. And that is just listed. So all the rates are just listed so you can see the different county rate numbers. If you want to go between different years, you would do that from the home page. So say if you want to look at 2 years ago, you just come up here where it says the DODD calendar year and click on whatever year you want to look at. If you want to look at numbers prior to COVID, you're able to do that. Just go ahead and change it. And also, these also can be downloaded. All you do is come up to the top, choose the format you want to download it. So say if it's numbers that you want to extract it out, you just go to crosstab. Crosstab helps you download to Excel. Are there any questions about the dashboard? Anything you would like to see added to the dashboard that's not already here?
So what we did is we,
Do we have one question?
Will these be printable?
I believe Lori's question was asking if the reports from here will be printable. Yes.
Printable.
Yes, you can just go right up to the top. And if you want it in Excel, you choose crosstab, PDF, or PowerPoint, and you can just print it right off. It's kind of similar to CBCP.
yeah, we looked at CBCP and Christie's report. We really loved it. And then thank you, Ravi. Is it Ravi? That guy is great. Within 2 weeks, he put all these things, I think less than 2 weeks,
Yeah,
right?
it was less. It was like
So
a
we're
week.
going to work with him. Would it be helpful, some of you guys,
Mhm.
that we create a test environment or something to go in there and put your county, test it, to see if you want any other information. See, some of the graphs are just, they are just bar graphs, one on top of the other, may not make any sense. I like more line graphs. It tells a better story, but maybe we'll go through the business managers committee and see if any of you are interested. We can create a kind of a UAT environment testing and then put it out there, and then you guys go play and say, hey, oh, this doesn't make sense. I want this in the graph. So we'll be publishing 23. We already published 23 Excel, right?
Yes, it's
Yeah.
already on.
So
the
we're going to
website.
work on 23. When we do that, all the years before will be on Tableau. And going forward, it'll be easier. But I think we still have to do the Excel side of it because your consolidated report is used by LSC. A lot of the people that ask for the numbers, you guys, some of your local elected officials ask because they are comparing similar counties when the budget goes in their budget, how much money they're getting, why they're getting less than the other counties. So a lot of things. I've been out of budget for a while now. So things like that. So I think it's more visual and more helpful. So if you guys let us know, or Julie, or any of the committees, if you're interested, you can throw it out there for testing. You guys have any other questions on cost reports?
All right.
Going back to TCM and the rates, I remember, oh gosh, 2018, 2019, we were told the sweet spot for a rate was between, I don't know, around $25. And an SSA who works 2,080 hours should have about 3,300 units a year. Do we have any numbers like that now that we could say, on average, this is what our SSAs need to produce? Or
there may be an efficiency thing done when we first came up with the rate, 1950, whatever the rate. I may have to go back and check, but we do not collect the SSA FTEs on your cost report. I wish, I can go back and work a lot of things with that, but we do not collect the FTEs. So I'll go back and check whether there was any efficiency if that's during the rate setting. And that would have been very average. And there's also talk, I think it was you, Steve, talk about, hey, the rate is too low, the 1950. So maybe there may be a time for us to talk with ODM to see, keep them quiet for a while so that the settlements are not high. So, but it's going to catch up, that, right? If you don't take care of, if you're not reporting the right units, I have seen it going up, the cost and the units, but that's not my place to question what you're doing and all that. What I'm telling you in that spreadsheet is you're not doing something right because you're telling me you're billing more than what you put on your cost report. And you haven't even done with your billing yet. You got one good, December, this I did in way back in, what was that, July, August? So you have like 4 or 5. The cost report was filed in July? So you have clearly 5 months left and few counties telling me. So it's just not picking on counties. It's just for them to tell, hey, be vigilant towards your numbers. Don't trust anything which comes from, Britco or something, and there could be some numbers. Somebody must have transposed, somebody must have entered a number wrong, right? So, we found a boatload of coding errors. I'm doing DC cost reports and, hey, people just pick and choose account codes because the Oaks does not, there's no relationship between program number and account codes, account number. So you can buy an equipment, it's 530 money for us. You can pick a 5526 account code. Oaks will let anything go through. So people just, when they do that, And in internal control is very hard to catch because it's a needle in a haystack. Because I can't just go and get every single transaction to go, but we are doing POs going line by line to see, hey, this is a capital asset or this should be expensed. It's about 1.2 million worth between the ATCs. We are doing that. I only have 1%. So if you guys don't have any questions.
Sam, maybe this is a question for you. Is TCM clearly is something where you see some unusual things pop up. Is there like a top 2 or 3 list of things that in the cost report you see come up regularly that kind of keep repeating themselves as inconsistencies or challenges? Anything stand out other than maybe TCM where it's like, boy, we've got to figure out why there's so much variation?
Julie, cost report, I think mainly units because cost is cost, right? But the only thing that we see most is cost being reported county to county. It's being reported separate, differently. Some of them put it in indirect cost, some of them, and we had something with the county. I'm not telling you names. We went several emails with them. They were just wanted that to be a direct cost, and we said no. I said, I know you did this with good heart, but this is an unreimbursable cost for you. I mean, we do employee appreciation stuff at the DCs. Doesn't matter how much we beg, they are unreimbursable staff cost. So they're like the donations. I mean, for us, advertising, promotional advertising, you know, a lot of stuff. So we go through that. But I think I see cost is not much, but units is what we see all the time. It's been reported, but when we do our desk reviews, we go to the county and we tell them, hey, would you mind taking another look at these units? And they have corrected it. They said, hey, and one time, I mean, this is kind of interesting. Last year, we were doing the settlements. One of the superintendents sent me an email and said, why am I the only county that is paying TCM? They were the only county that was paying TCM. So we looked at it and we sent her the cost report numbers and all that. According to what you reported, you're paying. You give me a chance. For me, luckily they were not audited. So we opened up the cost report. Remember that? Yeah. So we opened up. And they went from 30-some thousand to 80,000 they received. That's 110,000, not a big county, 110,000, you know, change in settlements. So we do allow, we not really, if you're audited, you're done. Because we can, by ORC, we cannot open up the cost report once you're audited.
And also, we do a higher level of desk review. We don't do as in-depth as the AOS. So we really go off of what AOS, what they're looking at in order to see what the trend is as far as TCM or any issues that we've noticed.
Other questions? Any other questions? All right. Well, we got a lot of information in this session and in previous ones. Please join me in thanking Cora and Julie and Sam. Whoop, we maybe have one other announcement or?
Just for members of the BLT, we have a meeting immediately following this session. So if you'll stay, we'll keep it quick.